Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining for another segment of Health Professional Radio. In this segment, we're going to be speaking with Barbara Abernathy. She's a rare blood cancer survivor. She's going to share her experience with graft-versus-host disease, or GVHD, a condition where the donor immune cells begin to attack the recipient's organs and tissues. She's joined by her physician, Dr. Hugo Fernandez. He's joining us here as Chair and Medical Director of Moffitt Malignant Hematology and Cellular Therapy at Memorial Healthcare System to talk about the importance of being vigilant about changes in your health or the health of those that you care about. Welcome to Health Professional Radio, both Barbara and Dr. Fernandez.
Thank you for having us.
Doctor, it is, of course, National Marrow Awareness Month. Tell us a bit about National Marrow Awareness Month and what we need to know about bone marrow and stem cell transplants.
So annually, about 18,000 patients have a blood disorder that requires allogeneic bone marrow or stem cell transplantation. This is a way to eradicate the disease, treat it with chemotherapy and radiation therapy, and also eliminate those cells with the treatment, but also provide the patient with a new immune system that helps fight that disease. About half the patients in that group end up getting this stem cell transplantation. And of those patients, about 50 to 80% will develop graft-versus-host disease, or GVHD.
So is there a drive during this month to get available donors or just to raise awareness, or a combination of the two?
It's mainly for awareness at this month. Our focus here today is going back to be aware of chronic graft-versus-host disease as it develops after transplantation. There's actually two forms of it. The first is the acute, which happens in the first 100 days post-transplantation and develops as either gastrointestinal symptoms, as a rash, or with liver problems. And then afterwards, there can be this attack of the immune system on the tissues and the organs called chronic graft-versus-host disease, which can present with dry eyes, dry mouth, skin tightness and or joint tightness, and also abdominal issues, among some of the signs and symptoms.
Barbara, if you would describe your journey with GVHD.
Sure, Neil. I was diagnosed initially with a rare blood cancer and was on a variety of different treatments, which ultimately failed to work, and I needed a bone marrow transplant, which I'm very grateful gave me a second chance at life. Shortly thereafter, I began having symptoms of acute graft-versus-host, which turned into chronic GVHD. And it manifests in a variety of ways, from gastrointestinal issues to severe dry eyes, severe dry mouth that has resulted in some pretty serious dental issues, and also skin issues.
Did you have any idea that this was a possibility going into treatment? Is it something that you expected, or were you totally surprised?
Well, in my job, I work with children with cancer, so I did expect that there was the possibility of GVHD, which was why I was really careful in selecting my physician, Dr. Fernandez, because I knew he had a lot of experience working with GVHD. But I think a lot of patients are pretty surprised and kind of blindsided by all of the symptoms that they have, because the transplant is the cure. So when you then begin to have a variety of symptoms that you have to deal with that are so intrusive on your life, it can be kind of surprising for a lot of people.
I would assume that you considered yourself relatively fortunate, having had a bit of a heads up based on your experience. What advice do you give those who may be going through GVHD or may have no clue that it's a possibility?
I think the most important advice is to work closely with your healthcare team about any symptoms that you might have, no matter how small or minor, because those need to be addressed early. If they're not addressed early, they can really snowball into big issues.
Just to add to that, if I may, it's very important that we discuss these and get ahead of these issues early as possible, because the treatment is important. It's also why we have partnered with Insight to spread the awareness of graft-versus-host disease in these patients. So the discussion, early action is very important.
Doctor, In your opinion, are there surgeons who are possibly less aware about GVHD than others who may be dealing with it on a daily basis? Are there challenges with determining that a patient is dealing with GVHD? Are there challenges with diagnosing quickly? Do these symptoms, are they often misdiagnosed as something else that could possibly be going on before a correct diagnosis is made?
Yeah, that's a great question, because there is this issue of ignorance of some of the symptoms. So it's really important, and this is where we get, to the patients themselves. We have them look up websites like GVHDnow.com, so they're aware of those symptoms, and we stress to them, call us in the moment you get these symptoms or you're seeing something that's not normal. Sometimes they take it to their family doctor and they're not aware of what graft-versus-host disease is. So the more that we can educate them on getting to us sooner than later, the better we can have impact on controlling their signs and symptoms.
Barbara, how are you doing now? Is this something that's an ongoing treatment?
Well, yeah, it is definitely ongoing. It's kind of a game of whack-a-mole in that as we manage one symptom, another one seems to pop up, which is why, you have to work with a team that you trust, and you have to communicate early and advocate for yourself. And for most patients, going to GVHDnow.com allows them to track their symptoms, monitor, and be able to communicate more effectively with their healthcare team.
Well, I do appreciate both of you joining us here on Health Professional Radio this morning. Quite eye-opening, and hopefully we'll have an opportunity to speak again with both of you. Thank you.
Thank you so much.
Thank you.
Again, that website is www.gvhdnow.com. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Barbara Abernathy and Dr. Hugo Fernandez. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.